Hello everyone, welcome to your lecture on infection and asepsis. These will be the objectives that we're going to cover in this lecture. What is an infection? An infection is any disease-causing pathogen or microorganism. It can either be on your body or in your body. It can be transmitted from person to person, such as a communicable disease. Now, if these pathogens, these bacteria or viruses multiply and they start causing symptoms, then it's called symptomatic. If the signs and symptoms are not present, then it's considered asymptomatic. Now, an important thing we need to remember is that infection occurs when the elements of the chain of infection are intact, present, and uninterrupted. Let's talk about the chain of infection. What are the components of the chain of infection? First of all, you have the infectious agent. These are your pathogens, your bacteria, viruses, fungi. It could include yeasts and molds. Now, some of these are your resident flora that live deep in your skin's layers or in your body, and they just live and multiply harmlessly. And then you can have transient flora. These are normal microbes that you pick up when you come into contact with another person or objects, and can be easily removed by just hand hygiene, right? The next element is the reservoir. The reservoir is the source of infection. This is where that pathogen lives, survives, and multiplies, right? And examples of these reservoirs are like the human body. Is the most common one. You have animals, insects, other living reservoirs, non-living reservoirs, such as soil, water, food, and environmental services, right? The next element is the portal of exit. This is the means by which the pathogen exits the body and goes to somebody else. Now, this can be through the blood, skin, mucous membrane, respiratory tract, your GI-GU tracts. It can happen through coughing. For example, if the bacteria is inside you and you're coughing, it can leave your body. Your portal exit would be the mouth. It leaves your body and then it goes to, another person. And examples are coughing, sneezing, diarrhea, vomiting, urinating, wounds, like drainage from wounds, vaginal discharge, bleeding. Then the next element is the means of transmission. Now, this is how does that microbe go to, another person? How does it transmit? This can be through direct contact, by just touching, kissing, sexual intercourse. Indirect contact, where you have contact with the fomite, a contaminated object that causes the pathogen to transfer. Then you can have droplet transmission. This is, again, that example we gave when we're coughing, right? So the pathogen travels in water droplets expelled as an infected person exhales, coughs, sneezes, or talks. It could also happen during suctioning and when we're providing oral care to our patient. So the usual method of transmission is for the droplet to be inhaled or enter the eye of the susceptible host. Another means of transmission is airborne. Airborne pathogens can travel through heating or air conditioning systems and infect large numbers of people, sweeping the floor or shaking out contaminated bed linens. These can stir up the airborne microorganism and launch them into the air. For example, the agents, for example, measles, TB, as well as other fungal infections, are commonly transmitted in this manner. The next element is the portal of entry. Remember we said that the reservoir, for example, you're the reservoir, you have an infection, you have a bacteria, you cough, the portal of exit is, your mouth. The means of transmission is the droplets that are coming from your mouth. Then we have the portals of entry. How does it enter another, person? This is considered the portal of entry. They can either enter the body through, either body openings such as, your eyes, your nostrils, your mouth, your urethra, vagina, anus. They're all potential, portals of entry, or cuts and scrapes and, surgical incisions. Vectors such as mosquitoes can create portals of entry when they bite through the skin. In healthcare settings, common portals of entry include wounds, surgical sites, and insertion sites for tubes and needles. That's why it's so important to make sure we keep these areas clean. For example, when a patient has a surgical wound, preventing it from getting infected for bacteria to enter that entry. And the next element is the susceptible host. So now we have the portal of entry, but then the person who is at risk for that infection. Why are they at risk? Why are they susceptible? Because their defenses are inadequate, against that invading pathogen. Various factors can increase the susceptibility to infection. Among them, age. Very young and old are more susceptible, more at risk. People who have compromised immune systems. These are people who are receiving like immunosuppression medications, for example, for organ transplants, or cancer patients, or patients with chronic illness, or people who have immune deficiency conditions such as HIV or leukemia. All of these people are very susceptible. And so this is the chain of infection. And as long as this chain of infection remains intact, the infection can spread. Pathogens can grow and multiply and become disease producing. But the goal in healthcare and with everything is to break this chain of infection and stop that from spreading. What are these are some of these disease-causing organisms. This is a list. We have, different types. We have, for example, common ones you hear about are E. coli, hepatitis B, HIV, TB, salmonella, we have Staphylococcus aureus. So these are different types of microorganisms. This chart gives you examples of a reservoir for these, how they are transmitted. So please review this chart. Then we have the stages of infection. The infection can be acute, rapid onset, short duration, for example, the common cold. It can be chronic, slow development, long duration. For example, osteomyelitis, bone infections are chronic and they last for long periods of time. The infection can be latent, where the infection is present, but there are no symptoms. For example, HIV and AIDS. A person might have HIV, which is latent. The pathogen is there, but it's latent, but they're not always infected. Then you have local symptoms. For example, locally in one specific area. For example, a patient that has a wound, they might have a wound infection. Another type of infection is a systemic infection. This is when this pathogen affects the entire body, and this can be very fatal. For example, sepsis, right? So the stages of infection are incubation. This is an interval between the entrance of the pathogen into the body and the appearance of the first symptoms. For example, chickenpox, 14 to 16 days after exposure. You see it normally a common cold, 1 to 2 days. Influenza, 1 to 4 days. Then you have measles, mumps. So it's a different. The incubation period varies based on what the pathogen is and what disease it produces. Then we have the prodromal stage. This is the interval from the onset of non-specific signs and symptoms. For example, when you're feeling just generalized weakness, malaise, right? Low-grade fever, fatigue. A lot of people think, oh, it's because I'm tired. I worked this long shift, or I was busy working in the yard and I'm just extremely exhausted. So they're not very specific symptoms. So for example, herpes simplex begins with itching and tingling at the site before the lesions appear. So this itching and tingling, somebody can just think, oh, it's just, maybe I'm just, I need to clean myself better or something like that, right? But then it actually is the beginning stage of the disease, and they're non-specific signs. This is where the disease is the most contagious, because you're not sure that you're not 100% sure what you have right now. So you still socialize, you're still in public, you're still, and so the infection spreads rapidly in the prodromal stage. Then you have the full stage, full stage or the acute stage, or what we call the illness stage, right? This is the interval when the patient manifests signs and symptoms specific to that type of infection. For example, for strep throat is manifested by a sore throat, pain and swelling. Mumps are manifested by a high fever and, parotid gland swelling. So now you know specifically, for example, COVID, we have specific signs for COVID, like coughing, things like that. So now you know that you're ill. This is the full stage, acute stage, and the symptoms are specific. Then we have the convalescence period. This is the interval when acute symptoms of the infection disappear. The length of recovery depends on the severity of the infection and the patient's host resistance. And recovery can take several days to months. Now, this is the time when your temperature returns to normal as well. Now, what are defense mechanisms? We talked about, pathogens. We talked about the different, this infection cycle and how infection can spread. We talked about all of that. Now, what about our defense mechanisms of our body, right? We're exposed to the pathogen. How does our body defend us? So the first defense mechanism is our normal flora. This resides on the surface and deep layers of the skin, saliva, oral mucosa, GI, GU tracts. These usually don't cause disease. They multiply and live harmlessly, right? They actually act as protective mechanisms for us, and they maintain a sensitive balance with the microorganisms to prevent infection. Now, when that balance is disrupted, that is when the person becomes at risk for infection. For example, when a person takes broad spectrum antibiotics a lot, right, they can develop a super infection, right? This is when your normal flora of your GI tract, gets destroyed or killed, and so now you don't have that protection. So broad spectrum antibiotics tend to do that. What are some other defense mechanisms besides our normal flora? We have, our urinary tract, right? For example, the flushing action of urine when you're peeing, right? It flushes away microorganisms on the lining of the bladder and the urethra. And then, so factors that can alter this are, for example, obstruction, or, through urinary catheters, or growth or tumor, delayed, urination, or catheters facilitate migration of the organisms to the bladder. So all of these can alter that defense. Then we have the GI tract, the gastrointestinal tract. The acidity of the gastric secretions, the gastric fluid pH has a pH of 1 to 2. And it is, when we have a change in that pH, then it alters the normal function, and it's not a protection for us anymore, right? So this can happen through administration of a lot of antacids, like if we're always taking Tums or other antacids. This can, make the pH very alkaline, and now it can't protect, our body anymore, again, from infection. Then we have delayed motility. It happens with impaction of fecal contents in the large bowel, or any obstructions that we might have from masses in our GI tract. All of these can alter that defense mechanism. Another defense mechanism our body has is the vagina. So at puberty, normal flora cause vaginal secretions to achieve low pH. This acidity inhibits the growth of microorganisms. But once again, how does that get altered? It gets altered through antibiotics, or oral contraceptives can disrupt this normal flora. And then now it affects the body's defenses against microorganisms. Another defense mechanism, first was the normal flora, then we have, the GI tract, the GU tract. Now we have, inflammation. Inflammation is a cellular response of the body to injury, irritation, or infection. So when the body is exposed to a pathogen or injury or irritation, the body's, the inflammation mechanism kicks in, right? It's a protective vascular response. It neutralizes, it eliminates the pathogen or dead tissue and starts to repair the cells. So the agents that trigger the inflammatory response, what causes that inflammation to get triggered? It's physical trauma, mechanical trauma, temperature extremes, radiation, or chemicals like external, internal irritants like poisons, gastric acids, and microorganisms. So what are the signs and symptoms of localized infection? Remember, we talked localized as in a specific area, for example, a wound infection. So what are those signs and symptoms you will see for a localized infection? They would be swelling, redness, heat, pain, tenderness, and loss of function in the affected part of the body. Now, signs and symptoms of a systemic infection include fever, increased white blood cell count, malice, like very generalized malice, weakness, anorexia, nausea, vomiting. You'll notice the lymph nodes get enlarged, and then you might have organ failure. So that's the difference between localized and systemic infections. Now, this chart here kind of explains, the whole process of inflammation, right? For example, you have the infectious agent. It caused injury to the cells. Then if you come down here, then chemicals in your body are released, for example, histamines, kinins, etc. Then now what happens? This release of the histamine causes blood vessels to dilate. It causes increased capillary permeability, fever, pain, white blood cells are, attracted to the site. And so then you have an increased white blood cell count. So if you notice the signs of infection, you have redness, erythema, swelling, edema, pain, increased white blood cell count. All of these are part of inflammation. What factors affect infection risk? Remember, anytime you talk about a body system or a disease process, there are certain factors that increase the risk of these things. So what factors affect, increase the risk of infection? Is the integrity of the skin and mucous membranes. Because remember, these are protection against microbial invasions. For example, as long as my skin is intact, I'm okay. But if I have a cut or, or an incision or something, then now I'm open to bacteria getting into my body, right? Then the pH levels of the GI and GU tracts. For example, your normal flora and your pH level in a GI-GU tract protect you from infections and microbial invasion. So now when these get altered, when the pH, for example, gets alkaline, then it can't fight bacteria anymore. We just talked about this about 2-3 slides before this. Then we have the integrity of the number of the body's white blood cells, which provide resistance. So now if you have a patient who has extremely low white blood cell counts, neutropenic patients, then they might not be able to fight infection normally. For example, people who have leukemia or people who have cancer or immunocompromised patients. You have age, sex, heredity also influence how susceptible you are to disease. For example, neonates, little babies, infants and older adults are more vulnerable to infection. Then we have immunity, natural or acquired, which acts as a resistance, right, against infection. For example, getting a vaccination, that's your acquired immunity, right, or natural immunity that you naturally have inside you. Level of fatigue, nutritional and general health status, the presence of any illnesses, previous or current treatments, or certain medications, all of these can affect a person's risk for infection. Stress level, which if you increase stress can adversely affect the body's normal defense mechanism. Then we have use of invasive or indwelling medical devices, for example, like Foley catheters, IVs. All of these expose us to pathogens. That's the reason why in the hospitals they always encourage to remove the Foley catheters as soon as necessary, as soon as they can. Then you have tobacco and substance use. This can also increase a person's chances of infection. Now we have age-related changes. This, because remember in block 1 we're focusing on, in fundamentals we're focusing on the older adult. What are some of the age-related changes that place an older adult at risk for infections? For example, when pulmonary infections, these are caused because they have a decreased cough reflex. They have, the the elasticity, recoil of the lungs is decreased. There's decreased activity of the cilia in the lung tissue, abnormal swallowing reflexes. All of these place a patient at a high risk of infection. In the column on the right, you'll see some nursing strategies that we can use, and these are extremely important for you to review, and please go over this. And for each of these infections, for example, for UTI, you have what in older adults, they have incomplete emptying of the bladder, decreased sphincter control. They have bladder outlet obstructions due to like enlarged prostate gland, pelvic floor relaxation due to estrogen depletion. Then you have reduced renal blood flow. All of these can cause an older adult to get a UTI. So on the right hand side, again, these are some nursing strategies that we can use to help prevent this infection. Then we have skin infections. We have loss of elasticity, increased dryness in older adults, thinning of the epidermis, slowing of cell replacement, decreased vascular supply, makes them susceptible to skin infections. What can we do? On the right hand side, again, there are strategies. We can encourage a patient to drink plenty of fluids, unless it's contraindicated, for example, in heart failure patients. Help prevent, help the patient perform good good hygiene practices daily, applying lotion to the skin as needed to keep it moisturized. Assess them frequently for any leaks in skin integrity or breaks in skin integrity, rashes or changes in the skin. Reducing the risk of infection. How do we reduce the risk of infection? Adequate nutrition, very important to maintain, so that the cells can, the body can, your immune system, can protect you against infections. Balanced hygiene, sufficient to decrease skin bacterial count, not, overzealous, causing skin cracking. Then rest and exercise, reducing stress, immunization. All of these are important in reducing infection. Here is some lab data that we check for people when people have an infection. These are some important lab data that we check. For example, elevated white blood cell counts, Normal values between 5 and 5,000 to 10,000. An increase in that can, indicate an infection. Then we have neutrophils, lymphocytes. And if you notice on the right-hand side here, it explains what the elevation in these different types of, the cells causes, over here in the why they could be caused, For example, neutrophils, they can be increased in acute infections. For example, sepsis, bacterial infections, things like that. Lymphocytes are, when they're increased, that can indicate chronic bacterial viral infections. So neutrophils are related to acute infections, lymphocytes to chronic infections. Monocytes can be increased in severe infections such as, a scavenger or a phagocyte. Eosinophils may be increased in allergic reaction and parasitic infections, and then we have basophils, usually unaffected by infections. So when we look at lab values and you notice, for example, the eosinophils are, elevated, it could be because of an allergic reaction as well, and not just simply an infection. So let's talk a little bit about HAIs and drug resistance. What is an HAI? An HAI is an hospital-acquired infection. So let's talk a little bit about that. What are these hospital healthcare-associated infections, They're acquired in the hospital, in healthcare settings, whether it's a hospital, a long-term care facility. These develop as a result of medical care and occur in many healthcare settings. And what are the sources? They're exogenous, when the causative organism is acquired from other people. For example, if you have a patient in the hospital, they don't have an infection, but the patient next door to them has an infection, and then personnel taking care of both of them, and say they don't perform proper hand hygiene, so the infection can spread to the person who doesn't have an infection. Exogenous. Endogenous infection occurs when the causative organisms comes from microbial, life harbored inside the person. So the microbes are inside the person, so they can get infected from the pathogen that's already inside them. Then we have iatrogenic, when it results from a treatment or diagnostic procedure. For example, the patient didn't have an infection, but then we did a certain treatment on them or diagnostic procedure, and that caused the pathogen to enter their body, and so now they're infected. So the most prevalent, most common healthcare associated infections are catheter associated urinary tract infections, surgical site infections, central line associated bloodstream infections, invasive healthcare associated hospital onset MRSA infections, then you have C. diff. These are the most common healthcare associated infections. The most common sites for healthcare associated infections include urinary tract infections, surgical and traumatic wounds, you have respiratory tract and bloodstream. Over here, there's different causes listed. What can cause this? For example, urinary tract infections. These can be caused by not adhering to the sterile procedure when inserting the catheter. And we're going to go over this in lab when we practice that skill. Improper positioning of the bag. For example, the bag with the urine in it that holds the urine, not positioning it properly can also cause them to develop a urinary tract infection. Any open drainage systems, drainage bag port contamination, like when you open the port to empty the bag and we don't, disinfect that port, that can cause, the bag to get, pathogens to enter, and then they go up through the tubing, the catheter into the patient. Obstructing the urinary drainage, urine from bag re-entering the bladder. For example, the urine that's in the bladder and is sitting there, it can start harboring microbes, and then when that re-enters the bladder, it can cause an infection. Repeated irrigations, improper, perineal hygiene, not providing the patient proper hygiene. All of these can cause a UTI. So please read over what can cause like surgical and traumatic wounds, the respiratory tract, and then we have the bloodstream infections. What is drug resistance? Drug resistance is basically development of microorganisms, primarily bacteria, right? And that, for example, resistance to one or more of these antibiotics that were originally effective to treat infections. So as we start taking broad spectrum antibiotics more and more and more, remember we talked about the normal flora in your body, right? That gets altered because of these broad spectrum antibiotics. So when a patient constantly takes these, then it destroys their normal flora, and that leaves them defenseless against microbes. So antibiotics that kill bacteria that cause illness, they also affect the good bacteria. For example, you have bactericidal antibiotics, they kill the good and the bad bacteria. So when you take it, your good bacteria gets killed too. That helps you. Normally that helps protect you. So common drug resistant bacteria include MRSA, VRE, and CRE. How can we prevent this? We can prevent this by preventing the spread of this resistance, tracking the antibiotic use. Let's, not just taking it generously, always taking antibiotics for everything. Improving antibiotic prescribing and stewardship. Antibiotic stewardship is when nurses work with providers to help prevent the prescription of unnecessary antibiotics. Right? Developing new drugs and diagnostic tests, to help prevent drug resistance. All of these are a way of preventing drug resistance. This over here is just quick, a normal, the nursing process and the clinical judgment model of, related to infections. Please read over this. As you can see, these are the assessments and cues that you're going to look for. And when you're, providing care for a patient or planning care for a patient with an infection. These are the analysis and the nursing diagnoses. Then what would you plan for the patient? Then implementation and evaluation. Please go over this chart and we will review this some more in class. Thank you.